Hello, my name is Jill Bray-Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing hot healthcare topics. Today we welcome Dr. Richard James. Dr. James is the medical director at Northwestern Urgent Care, and he most recently worked at Dublin, Ireland in urgent care. He also has experience in sports medicine and works at Northwestern Orthopedics, so you're pretty busy. But today we're going to talk about urgent care and what you might do or need to do to access urgent care. So maybe start off by talking to us a little bit about urgent care and what that means.
Well, it's a slightly more acuity or illness level than you would perhaps get if you were seeing your doctor at a regularly scheduled visit. It's less acuity or slightly less emergent problems than you would go to an emergency room for. And so, for instance, if you cut your hand slicing cucumbers and needed a stitch or two, that would be a perfect situation. Usually those sometimes occur around dinner time, coincidentally when we're open. So that's sort of the typical way you'd access the system.
So we have two actual locations. Do you work at both of those locations, and how are those connected?
I work at both, and they are connected through the Northwestern Medical Center umbrella, but they operate independently. They have their own staff, but we have a lot of overlap between that. For instance, I work at both locations. Sometimes some of the other staff work at both locations. Mm-hmm. They have similar hours and operate very much the same with similar services, labs, x-rays, things like that they share. The same types of things they offer.
Super. So we have one located in Georgia and the other on the campus of the hospital in St. Albans. And
right.
The one in Georgia used to be called the walk-in. So is there a difference between walk-in and urgent care, and what made us kind of change those names?
Well, there's the emergent care or urgent care delivery can be named a number of ways. Walk-in was how it was organically arrived at, but nationally the organizations are referred to as urgent care. In Ireland they were called swift care, so they tend to, if they're not using urgent care, they tend to epitomize what you're trying to do there is walking in and waiting to get seen. There's no appointment necessary, or swift as in fast. But sure. the nomenclature used here is urgent care in the U.S. And it's through all states more cohesively thought of as urgent care rather than walk-in. But nothing's changed after the naming. It's just that it's more consistent with what everyone calls it nationally. And it, urgent is what it is, rather than walk-in could be a variety of levels of care. Mm-hmm. Normally you arrive by emergency room either walking in or by ambulance. Someone drives in, but probably the vast majority actually do walk in to the emergency room. So it's not quite the right term.
Sure.
But urgent care would indicate what kind of things need to go to the emergency room, to the urgent care rather than the emergency room.
Great. Thanks for mentioning an emergency room, because I think that's one of the big questions that, you want everybody to have a primary care provider, so to make sure that they get their regular health care with their primary care provider. So you have primary care, and then you have urgent care, and then you have the emergency department. So how do those differ, and particularly about urgent care and the emergency department? So when do you know where to go?
Well, I already gave you one example, Jill, with the other ones you might say are by example. For instance, if you've had diarrhea for 2 months on and off, and it's been there for 2 or 3 months, or the level of time is in that framework of some other problem for 3 months, that might be something you would see your primary care doctor for. If you have a known history of having had a bypass surgery or stent placement and you've taken your nitroglycerin for chest pain and you're still having chest pain, that'd be something you go to the emergency room for. If you've just developed a problem a couple days ago, whether it's respiratory, whether it's even a sharp pain when you take a deep breath in, you have fairly young and healthy, you just don't know what it is, want to get some information about it. Perfect example of urgent care. So those are sort of, by example, types of things. There are specifics that we have on our website of what things you would go to emergency room, what you would go to the urgent care for. Certainly extreme pain, large amount of bleeding, but that cut with the slicing your cucumbers, that's going to bleed quite a bit.
Sure.
So you'll see quite a bit of blood. But if a plate glass window fell and you had a 1 foot long cut on your abdomen, that would be something emergency room probably.
Okay.
Maybe internal organs, things like that. But people don't have to really think about it. I think in general they have most people have a pretty good sense of what seems to be the direction to go. But in a broad term, if it's something going on for 3 months, then definitely should see your primary. If there's something that just happened 4 or 5 days ago and it doesn't seem to be rapidly escalating where you can't even stand up, that's perfect for urgent care. Something where you can't stand up, call the ambulance or have a friend drive you to the emergency room. So I think that's probably the way I'd look at that if I were
differentiating those different groups.
A future patient, trying to decide which way to go.
Sure. So if someone went on to the website and checked kind of what things you do at urgent care, what are some of the things that you do find at urgent care? What do you often see when you're seeing patients?
A lot of sprains of ankles or strains of shoulders. Sure. A lot of colds, pneumonia, respiratory problems. Maybe a little bit of stomach flu, something like that. Rashes. Lacerations of a limited nature. You haven't just suddenly cut your finger and you can't move it, but it's a cut and needs to be sewn up. Those types of things we see mostly. Sometimes something flew in your eye. Those are the kind of things we see a lot of. But it's certainly open to a variety of other things, but that I probably left off. But those are probably the main things.
Okay, great. Great. So I know the one in St. Albans is located right next to Northwestern Primary Care. So is there, do they work together in seeing patients there? And then also if you could comment on how do you stay connected, or how does the program stay connected to primary care? Because it's an episode of care. And when you think about the blueprint and the medical home and really care being centered around primary care, how do you stay connected to primary care or keep the patient connected to primary care?
Well, there are some advantages that we have to staying connected, especially if the primary care practice is on the electronic health record that we use. That's a very easy way to access some of what their ongoing problems are that may impact their current health presentation or illness that they're presenting with. But also the converse is we make an effort to send all of our notes and what we've done that day back to the primary care doctor's offices, even if they're not connected with our electronic record. And if, for instance, we get this a lot, there's sometimes people say, I can't find a primary care doctor, we have a list and we can either call up if it's something that they want us to organize, or they can call and make a decision after talking to friends and family and deciding which way they want to go for primary care doctors. But so we try to keep it very well connected to that.
That's great. So what type of background do you need to work in an urgent care? What type of staff do you have available?
Well, it can go from steady pace to fast paced, often 2 or 3 things happening at the same time. There are obviously the lacerations, so we have staff who are comfortable sewing up lacerations, evaluating depth of wound, other serious injuries that may occur. There's the chance of a fracture with any sprain or soft tissue injury, so reading x-rays there. We have radiologists who all read our x-rays as well, so we have a lot of expertise applied to the problem. And we have the ability to inhaled breathing treatments or those are important aspects to be able to give, assessing rashes and infections and things like that. There's some point of care labs we also do. So being able to interpret that and then sort of being in and out in 20, 25 minutes or 45 minutes actually from door to door time, that's also a skill that our staff have that's important to have, because although you're not looking at maybe 500 diseases in one person, you are looking at trying to get them back to their daily life or afternoon life or morning life in a as quick as possible and very convenient way.
That's great. So when someone actually comes into the center, what do they what's the flow look like? What could they anticipate, and what the in and out time? You mentioned a little bit about 20-25 minutes, but so kind of what's the expectation when you arrive? You know, what do you expect to do going through, and then how long should they expect to be there?
Well, when someone arrives, we hope if they do arrive by themselves, they'll make themselves known. We have a small enough office in most locations that we can identify someone walking through the door, making sure that they say, okay, how can we help you today? And they mention why they're there, and we get them entered into the system if they're not part of the system, and brought back into a room and started with the process of medical intake, doing vitals and things like that. So the whole process should take about 45 minutes from stepping in the door, saying, "Oh yes, I am a patient here," or I'm with someone else here who's the patient, to checking out and leaving. That should take about 45 minutes.
And you mentioned you can draw labs and do X-rays right there in your
exactly.
site?
Yes, yeah.
Okay.
I did allude to that. There's X-rays. So, for instance, if you twisted your ankle coming out of the shower or tub, we'll do an X-ray to make sure you are not having a fracture there that needs a more complex treatment. Or if you are wondering if you have a thyroid dysfunction, for instance, we can do a lab there. That gets sent off to a central lab that runs the test, and that takes a few days to come back. But there are some point of care things we can do. For instance, if you are worried that you have strep throat, we can do that and give you an answer immediately. So there's a variety of testing we can do there.
Great. Now, what about age? Is there any age limit, or what age range do you see?
Well, we see every age. The under 2, we can see the 82. We can see the age group is not as important as the acuity level. So, for instance, if someone's 82 and may need a breathing tube placed down, that's when we call an ambulance to have them taken to the emergency room. That may have been just one of those situations where someone wasn't sure of which direction to go. Same thing if someone's 2 months old, but it's more disease driven than age driven. Okay. So age is not a problem.
Great. So you accept everyone.
Right.
For sure. Okay. And what about hours? Your availability?
They're pretty similar in both locations. 8 o'clock to 8 p.m. Monday through Friday at the St. Albans location, and 8 to 7 in the Georgia location. And then we have weekend hours on both days in St. Albans and on Saturday alone in Georgia, and so we have pretty good coverage there for when most people want to get in to see us.
That's great.
Yeah,
that's awesome. Well, thank you so much for being here to develop the urgent care, in our community, because I think it's been much needed to fill that gap when you can't quite get your primary care provider. So I think it's a service that's certainly needed in the community. And I remember that open house where you're cutting the ribbon, and it was really awesome to see such tremendous community support. So
we were very lucky. Had good weather that day.
We did. So hats off to you and the providers, and thank you for serving the community.
Oh, yeah, you're welcome. Thank you. Thank you for having me.
It's been a pleasure having you here and getting this great information out to our community.
Thanks a lot, Jill. Thank you.
So this is Jill Bowen, CEO of Northwestern Medical Center, and your host of NMC Healthbeat. Thank you so much for joining us today to talk about urgent care in our community.